Welcome to our vlog on adapting the technical model of the snatch to a variety of athletes that you may encounter in the weights room as an S&C coach. We've described 4 variations for 4 different athletes, and first up we have the rationale for the post-operative or return to play athlete. So this is adapting the snatch lift for a post-operative athlete, and the athlete that I'm using is called Ben. He's currently 18 months post-surgery for a complete patellar tendon rupture. You can see on the x-ray the kneecap is not where it should be. The surgery was very extensive, taking a hamstring graft as well. So we're now 18 months post-operative. And he's back to full training. However, he has been having some niggles with his knee on full load lifting and squatting. In these warm-up movements, you can see he actually is now moving quite well. He can achieve full knee flexion and can squat with load. However, these little niggles seem to be exacerbated by any load above 90 degrees of knee flexion. So what we're doing in this particular video, in order to adapt the lift so that he can still receive the strength gains from the lift itself, we're going to use power snatches from the blocks, so that the start position is slightly elevated, and then we're also going to use a power snatch variation rather than the full snatch, especially with load, in order to prevent excessive knee flexion again in the catch position. I've used Ben's warm-up movements and slowed them down to have a little look and see what's going on here, and what we see is a lack of upward hip extension or upward bar path as well, which results in the bar sitting slightly behind his centre of gravity or centre of mass, and the shoulder being extended behind him. So in the first drill, all I've done is I've placed my hand on his lumbosacral junction with his permission in order to try and resist the extension of the hip prior to the extension of the ankle and knee. So the hand positioning is stopping him from letting his knees come too far back behind the bar, and also keeping his back angle fairly neutral throughout the majority of the lift. So we're trying to explain to him in terms of coaching cues that using his legs like a concertina effect, so keeping the low extremity chain into that flex position, then into extension, whilst also generating power from the heels rather than the forefoot going into the floor, therefore trying to load up the glute and hamstring complex more so than carrying load through the patellar tendon on the anterior aspect of the knee. The next few clips show without a physical cue or without verbal cues. So now what we see is a better extension at the ankle, knee and hip that's more simultaneous, and a much straighter bar path, which means that he's generating more force from that hip position. That's going to help strengthen the glute and hamstring, which then will help increase the balance between the quad and the hamstring complex. So what we've done now is we've added load only up to 30 kilos, we've taken the boxes away and we've put plates down to keep the bar at just below the knee. And we're just going through exactly the same, keeping a power snatch there. The cues I'm giving him are to keep the bottom down, keeping a neutral spine, holding the shoulders over the bar. And I'm asking him for feedback in between to make sure that the knee is feeling okay. In the power snatch position, he didn't report any pain, which is obviously a pro. And he commented that on the start position from the blocks, either blocks or boxes, that he very much felt that his hamstrings were firing as he came through. He's quite autonomous as an athlete, so he's able to give me good feedback on those changes to his technique and how that feels, and what feels better and what feels worse. So as we go on with the reps, we really see a much better bar path placement, more control of the bar, and we start to see a triple extension position, which is much more upright. So now we've taken the bar to the floor because his start position is still not below, is still around 90 degrees of knee flexion. Again, we're having to put a slight physical cue in to keep that neutral spine angle in relation to the floor, so that angle not changing as he comes into triple extension. Now that we take the block away, when we look for the first pull from the floor, we see very slight issues with the first pull section affecting his triple extension. So all I've asked him to do on this particular drill now is looking at his actual extension pattern. So I've got him empty bar in a high hang, and he's actually standing up onto his toes into full dorsiflexion as he would in triple extension. And we're trying to get him to shrug underneath the bar into a power snatch from this position. Now you see in the video, Ben eventually recruits more lumbar extension in order to achieve that position, rather than using the toe, foot and ankle complex to drive that upward force from the floor. And what we also see on the video is it starts to get a little bit more difficult between reps, so there might be some capacity elements to this in the actual lower extremity endurance and strength area. Now, interestingly enough, we had a conversation about this whilst we filmed it, and it turns out that on the right hand side, Ben has a condition called hallux rigidus, which is where the hallux or big toe, the metacarpophalangeal joint, actually starts to stiffen. So he finds it very difficult to go into neutralized dorsiflexion on the foot, and he has this real potential to come into a more supinated position through the foot. And what this does is it means that the majority of his weight bearing is actually going through the left side, which is the same side on which he's had the patella tendon reconstruction. Now I've looked back through his lifts, and from start to finish there is an improvement in his actual bar path position and the utilisation of the hip and lower extremity as a simultaneous block much better. And all we've used in our coaching process is try to pick up where his problematic areas are and resolve them using external objects, so blocks, plates, and changing the variation of the lift itself from a full snatch into a power snatch. Now my coaching process with this would be that as he gets more comfortable with the strengthening accessory program he's doing outside of his maintenance workouts, would be allowing him then to start to squat deeper and deeper. And we currently have him on box squatting for loading, and we're gradually bringing those squat levels down to make this easier for him, but also so that we can check in with him and make sure that his pain levels are well maintained and managed, and that they're not getting any worse. Next up, we have coaching variations of the snatch lift for a novice athlete in the weights room.
So for the purpose of this vlog, I'm going to analyse the snatch of a particular athlete. I'm going to analyse and compare their technique to a technical model of a snatch. We're going to look at things they do well, things they don't do so well, what they can improve on. And within that, I'm going to look at exercises that they could use, or techniques they could use in order to improve positions or phases of the snatch. And this will be broken down into derivatives of the snatch and how they can be incorporated into training. So the first thing we'll do is we'll look at the full snatch, and we'll look at the athlete just performing from the ground before we go into analyse his technique in detail. Even at full speed, you can clearly see a few deficiencies in his technique from the start position all the way through. Some of these are quite common errors that he's making, so hopefully this will transfer to many athletes. So if we break down the movement and we start with the start position, bar position is close to the shins. The bar placement is just above the first lace of the shoe. What we can see is the torso is too far, it's leaning too far forward. We need that in more of an upright posture. You can see from the green line that it's almost parallel with the ground, and this isn't going to set up well when it comes to the first pull or the transition phase. When we look at the first pull, we want the back to stay in the same relative angle to the ground as it was in the start position, which it does do. But at the end of the transition phase here, we can see that he's leaning too far forward. He's going to need to compensate now at this point in order to get the bar above his head. And what we see compensation is he jumps forward, hips come through the bar. We're still seeing triple extension, but he's jumping too far forward in order to catch the bar over his head. If he was to jump straight up, the bar would have just fallen down. He would have been catching it in front of him. Alright, so let's look at it again. We can pretty much tell that the athlete isn't that experienced in the lift, so we may see something different in the second repetition. Start position. It's obvious that thoracic extension is a limiting factor in the athlete's start position. Relative angle stays the same again, so this is something that he's obviously ingrained and that he can repeat. Towards the end of the first pull, we can see that the bar path has gone backwards, weight has shifted from the heel into the transition. He's a lot more upright. Weight going from the heel to the midpoint of the foot onto the ball of the foot as he triple extends through the hip, knee and ankle. Bar stays close to the body. Now he's getting underneath the bar and we haven't still a bit of forward jumping, but when we broke, like, that second repetition did look a lot better. So now the question has to be, we know what the athlete's good at, we know what the athlete's bad at, we can see the limitations in the movement. What can we do in order to correct them? What exercises are there, or what techniques are there to improve that thoracic extension, to improve torso angles, to improve the triple extension, to reduce the amount of forward jumping that's happening? So we're going to break down into a few derivatives of the lift, and hopefully that will improve the athlete going forward. A good place to start would be the start position. But you can clearly see that thoracic extension is a limiting factor in getting into a good start position for this lift. We know that compensations occur due to a poor start position, torso not being upright enough, this leading to inadequate extension of the hip. So what you could do is we can get into heavy start positions so that we're looking at isometric contractions, forcing the athlete into a good start position, squeezing the shoulder blades together, and hopefully ingraining that movement pattern over time. Other techniques that we could use, not related to the lift in itself, would be things like archer pulls, where we're working on that extension of the thoracic, mobilizing the spine, opening out the pec area, releasing any tightness that might exist around the shoulder capsule. There might be a tight glenohumeral joint coming into play there, because we can see that obviously the shoulders are very rounded. Things like band pull aparts, strengthening the rear deltoids, just allowing the posterior chain to come more into a mobile and efficient start position. Again, with the second pull, we see a limiting factor in the triple extension and that forward jumping. What we could do is we could implement some drills such as, or derivatives such as hang from pull, or clean hang pull, or hang pulls. Studies have shown that you can still elicit high forces and high power production in this movement, so it's not necessarily going to take away from the training effect, but it may improve the whole lift in general, as it would encourage the athlete to project their body more upright as opposed to in a horizontal direction. And again, another exercise very similar to the hang pull would be hang pull but from blocks, so we can actually lift the bar onto blocks so that we're taking out the start position. We can just look at the movement from what would be midpoint of the transition period, so just above the knees, and what this does is, as well, it just allows that vertical forces to be trained and ingrained, and hopefully eliminate any horizontal movement that the athlete might produce, especially as the weight gets heavier. Any horizontal movement is just going to, the bar will move forward, and it's going to be very hard to catch that bar in an overhead position, as the bar is already going to be moving. Trajectory will be moving forward as well as up. In summary, incorporating derivatives of the lift such as hang pulls or pulls from blocks, as well as isometrics in that start position, can all help improve the lift as a whole.
Now we come on to the intermediate athlete, someone who's already had some experience of the snatch in the weights room.
Just going to start here by looking at the start position for the athlete snatch. So you can see here that overall the start position is fitting with the technical model. However, just highlighting here the spine position or the back position, you can see the slight lumbar flexion of the spine in the lower region, in the lower back. So the athlete just maybe needs to work on maybe getting the hips a little bit higher, chest a little bigger, and really kind of being nice and tight in that position to make sure that doesn't occur. It may be something the athlete needs to work on, so maybe hip mobility, or maybe just kind of like a pelvic kind of area needs to be improved. But overall, it's not a huge concern, although it's just something that maybe would improve that aspect of the start position. Next, we're just going to look at the athlete's transition phase. As you can see here, knees come under the bar and in front, with the hips extending and the torso becoming more vertical. Weight kind of shifts towards the midfoot at the end of the transition, with the bar brushing upper thighs and the athlete reaching that kind of jump position, which is important to perform that explosive second pull. However, the elbows are starting to flex a little bit, so the arms and elbows just needed to be probably less bent and kind of more straight, with elbows pointing along the line of the barbell. Next, we're just going to look at the athlete's first pull. You can see here as the bar starts to leave the floor, torso angle remains the same. The bar does move backwards and then knees extend. So overall, the first pull is something the athlete is actually performing well. Just maybe the hips raise a little bit too quickly before the bar actually moves the floor. Again, the athlete just needs to be cued on that. Overall, the first pull ending above the knees and in a good position for then the athlete to then go into the transition. From the highest point of the second pull, then the athlete gets under the barbell to catch and receive the bar in an overhead squat. The athlete can catch the bar quite far behind the crown of the head, so probably doesn't actually need to catch the barbell that far behind. However, shows he's got the range of the shoulders to be able to do that. However, I think with the barbell maybe just coming a bit far away from the body, it causes the athlete maybe to not get in the most ideal position to catch the bar, and as a result lacks depth in the catch. So I think definitely confidence from the second pull into the catch needs to be worked on, and then stabilising that bar there instead of letting it go too far behind definitely needs to be improved, so then we can result in getting more range on the catch. So an area, definitely confidence dropping under that bar is an area to work on. So from the transition, now we're going to look into the second pull. So you can see here the athlete performs the second pull with an explosive triple extension at the ankle, knee and hip. However, the athlete could probably combine this more with a much more violent shoulder shrug to make sure the bar stays a lot more closer to the body and travels up more vertical. As you can see, the bar starts to move a little bit further from the body, making it a bit harder for the athlete to get under the bar. So, the athlete may need to work on some hang snatch pulls from mid-thigh or from the floor, just to work on really mastering that second pull in the sense of really triple extending fully with a shoulder shrug with the movement also. Furthermore, if the athlete then starts to use the elbows, so at the highest point of the second pull starts to drive the elbows up and out, this may result in the barbell being close to the body as well, so that might be a coaching approach you use with the athlete. So to improve the second pull and making sure the bar stays close to the body, the following exercise such as snatch pull from the floor can be used. As you can see here, the athlete is just getting used to, combining a really violent shrug, not worrying about the catch as such, but just being told to generate as much force as possible and really combine a violent shrug, so to see if that makes a difference to the bar keeping close to the body, as well as see if the bar travels up a little bit higher up the body as well, so I'm going to get into a good position to catch the bar. So if I just slow this down, you can see here that the barbell during the second pull is kept a lot closer to the body as a result of that violent shoulder shrugs. This might be a method used by the athlete to improve the snatch and in turn the catch. To help improve the athlete with the catch, this exercise, such as the snatch balance, can help the athlete develop more confidence getting under the bar quickly and stabilising the bar overhead. So the athletes are adopting a wider kind of stance position to allow for a greater depth. This may be something the athlete does when performing the snatch, also to see if that helps with the catch position. But if the athlete keeps practicing this in his training program, as well as maybe increasing the load, so maybe like a 5 to 10 kg either side, this may result in the athlete being able to drop into deeper positions more confidently at a quicker rate as well. After the catch, the athlete now performs the recovery. You can see here the athlete leads with the chest, extends the ankle, knees and hips, torso upright with a good spine position safely, and is able to perform that work. So overall, looking at the athlete's snatch, we've identified that the second pull, the explosive kind of shoulder shrug, and the catch need to be worked on. So the hand pull from the floor is a way for the athlete to really work on that triple extension where peak forces should be occurring and the speed should be fastest of the movement. Furthermore, if we combine this with the snatch balance, this should help with the athlete's confidence dropping under the bar, and from here that should make sure that the snatch results in a much more fluid kind of movement with a deeper catch position. So for other athletes who experience these kind of difficulties or common problems, or even kind of coaches working with other athletes who see this happen a lot, this could be an intervention they use also.
Hi guys, and welcome to the final part of adapting the coaching process for the snatch. Here we're going to be looking at masters level and injured athletes. This athlete is John. He is currently masters level at CrossFit, and previously he's played rugby and MMA. His main complaints are intermittent lower back pain, which is managed with osteopathy on a monthly basis, shoulder stiffness, and he generally finds the snatch movement quite awkward and painful. So that's the key things that we're going to be working on today. So the aim of his training, firstly, is to remain injury-free, and it's really important that this remains a priority throughout our coaching sessions. And secondly, is to get stronger. So the considerations when working with masters level athletes or those who are injured is that the warm-up normally needs to be longer. This is really vital because the athlete must be in a good position. Obviously, dynamic movement is important for increasing blood flow and mobility as always. However, taking some time for activation, balance and stability exercises is particularly important in the ageing population and those who've had previous injuries. This is to help reduce the risk of any compensatory issues which may be causing them difficulties. For example, ankle mobility may seem to be a problem, however, the actual initial cause is because their hips are stiff. So spending more time mobilising the hips, activating the glutes, and stabilising the feet without shoes on would be an appropriate way of increasing the length of time for a warm-up in this population. Secondly, the injuries need to be managed appropriately. Similar to the previous point, the lumbar spine mobility is affected by hip and leg tension. And you also need to consider the amount of time the athlete is pulling off the floor if they've got back pain, And a good way of monitoring this is having a daily check-in with the athlete. This helps you as a strength and conditioning coach create a log about which exercises has maybe increased the discomfort your athletes felt, and you can log this whether it's the next day or 2 days later, or whether there's a combination of exercises that haven't worked particularly well. But having this daily check-in is really important for that. During the initial assessment, we just asked John to do a few full snatches, just to get an idea from the front and from the side what his ideal movement strategies would be. And as you can see, there are a few maladaptations that he's managed to acquire, which do predispose him to lower back and shoulder issues. So these, in summary, are that his anterior lean and his back is slightly rounding. The bar sweeps out and away from his body, and he lifts the bar with his back rather than his legs, and he also extends his lumbar spine when lowering the bar back from the top position above his head. And he's also tucks his pelvis and is quite unstable in that bottom position. And so, as we've mentioned, all these factors cause his lower back and shoulders to work harder. So what we did was we broke the movement down into the overhead squat, the snatch deadlift, the snatch high pull, the power snatch, and then a pause full snatch. We can see from this video that he's very unstable in his shoulders and is in fact possibly too mobile, and he also has a large amount of pelvic tuck. The athlete was then told to push the bar to the ceiling on the way down as well as the way up. You can see how much more stable this makes his overhead position. We then analysed a snatch deadlift, and it's apparent that he's very quad dominant and uses anterior rather than posterior chain, causing the bar to be out in front of him and his back to round, causing a poor start position. Similarly, his triple extension is fairly weak and not particularly explosive, and you can see particularly in those first 2 reps how the bar swung again out in front of him rather than upwards. This was followed by some power snatch from the blocks. This is a much nicer movement to watch on him, although again it's clear that he tries to kind of shrug the bar up with his arms rather than using his back. And here in the pause overhead squat was a really nice way of getting him to think about stabilizing through his shoulders and trunk, holding that bottom position, and once there, being able to kind of feel for his balance and stability rather than just kind of muscling it up. So it was really important with John to show him these videos and to show him some of the mistakes that he was making. This awareness really helped him to understand how what he thought was limiting his snatch, which was he thought it was his shoulders, was in fact a inability to stabilize. And again, he thought his mobility was quite bad. In fact, his mobility is really good, as we can see, and it's just a question of learning the techniques of the lift and activating his posterior chain more, which will really improve his ability to snatch. The aim of this video was to highlight some of the limitations of pain and mobility in a master's level athlete. Interestingly, the problems can often be different to what the athlete expects. In John's case, his main limitations were his technical ability, and also understanding that stability is much more important than mobility in this consideration. It's also important for John to improve his posterior chain strength and his spinal stability when pulling from the floor. This is to avoid these 2 images here, where his lumbar spine is rounded and not in a very strong position, and also here where he's descending the weight and extending his spine. Ideally, you want the weight to be dropped forward and in front of him. So the intervention is going to be a top-down approach. He needs to make sure that his arms remain long and strong to maintain that overhead position. Initially, pulling from the blocks until his spinal alignment is correct and strong enough, and also to drop the weights forward without arching his back. In summary, there are several aspects that need to be considered when coaching master athletes to snatch, particularly as having a longer, more dynamic warm-up with consideration of balance and stability exercises, taking a log of their injuries, so understanding which particular movements cause pain, and also breaking the movements down.
That's the end of our individualised variations on the snatch lift. The overall takeaway from this is that as S&C coaches, we need to remember when coaching the snatch lift that each athlete is an individual. We need to consider their current and previous training history, as well as their current health and their ability to perform the movements. These aspects will lead into a decision as to whether we will use the entirety of the technical model or pick up key points or aspects of it to use with the athlete. Working with team coaches will also help us to realise where we would need to use the snatch in order to gain the benefits, i.e. are they looking for power? Then we would be looking at potentially variations of the snatch lift, such as hang power snatches, hang snatches, etc. We need to be able to adapt our understanding and coaching of the technical model in order to cater to an athlete's needs.